of those different things. And that's kind of our job as nutrition educators, is to make sure that we are well versed in different aspects of nutrition. I do a blog, and this is kind of where my nutrition literacy outlet is right now. My blog is amandadnutrition.com. And the goal of my blog is to make nutrition education simple and easy for everyone. And so the topics are general and they're simple, and I don't try to make nutrition hard because it doesn't have to be. My recipes are easy. Typically my recipes are very cost effective, and they are recipes that normal everyday people are going to think, I could make that at home. Sometimes these bloggers, and they look fantastic. The pictures are wonderful. Mine are not so wonderful. I'm trying. But some of these bloggers, they make foods that, I mean, I wouldn't eat. So my blog is really geared towards making nutrition and making healthy foods feasible for everyone across the spectrum. So I enjoy cooking. I love making recipes, testing recipes out. I love the outdoors. It's getting really cold. I'm here in Western Pennsylvania in the Johnstown area, and it snowed yesterday. It did. So I still love the outdoors, but it gets a little more chilly, and I need to wear my big boots when I go out. I love Pittsburgh Penguins. Pittsburgh Penguin hockey is my jam. That's what I love to do when the kids are asleep. And yeah, I do have identical twin boys and a kindergartner. So I'm pretty busy when I'm not doing nutrition. I am keeping 3 kids alive. So it's an important job. So today, what we're going to go through is we're going to talk about nutrition literacy and why it is so important, and how it can kind of translate into our work life, our client life, and then even our everyday life. Think about when you go out to dinner with people. They're always talking about the newest diets or the newest fads, and how we could just communicate better with people about nutrition. We're going to take a look at nutrition literacy disparities, recognize them, and then, not to just let that go, but then our third objective is to figure out what we can do in order to make these barriers, in order to break them down. So in order to make our communities more healthful. So it is actually Health Literacy Month. Happy Health Literacy. Health literacy requires a lot. It requires reading skills, listening skills, math skills. As I was doing my research on health literacy, it was eye-opening to see. Health literacy includes the ability to understand instructions on prescription drugs, appointment slips, medical education brochures, doctor's directions, consent forms, negotiating healthcare systems like the insurance company. I work for the insurance company, and it is hard. I was confused. And so health literacy encompasses all of that. This incredible statistic here that I have on the screen: 99% of American adults can read, but only 12% are health literate. Only 12%. And that usually includes the individuals who are working in the healthcare field. So if we think about that, if we think about all that goes into to understanding fully health literacy, we need to be visually literate. Okay, we need to be able to read. Sometimes it's graphs, sometimes it's charts. People with diabetes, their blood sugars often get written up on a chart, and their doctor can see it, and they need to be able to read that as well. To be able to be computer literate. How many of you, do your doctor's offices now use an online system where you can go on and you can refresh your prescriptions, or you can ask a question to a nurse, or you can even see your blood work and things like that on their system. Numerical literacy, and this is something Rose and I had talked about, calculating dosages of medication. I don't know how many times that people have come to me and they're like, I don't have a clue how to take my medicine, or they're not doing it correctly, or they're taking a supplement, let's say calcium. They're taking calcium with things that actually block calcium when they eat. And so they're not, um, they're not educated in how to take their medications or supplements. And it's actually either doing them harm or not doing them any good. Understanding their risks and benefits when they go to the doctor's office, and the doctor, have you been there when you're at a doctor's office and they're telling you something and you're either so overwhelmed by the information, you're maybe in a stressful situation, or they're just talking way over your head. My twin boys, they were preemies, and we were in the NICU for a couple of weeks, and I was so overwhelmed, and some of the time I just had no idea what they were saying. And luckily, when you work in the health field or the nutrition field, you kind of have the mindset to say, I didn't understand what you were saying. Could you please repeat that? But a lot of times I felt very confused. And so thinking about this when we talk to our clients or our patients, if you're a clinical dietitian or you work in a setting like that, thinking about this when we talk about nutrition, how they may feel like a deer in headlights. And so we want to make sure that we're sympathetic to that and we're empathetic to that, and taking a step back in our role and saying, okay, I've explained weight loss to you. How do you feel about that? Are you understanding everything I said? Is there anything that I can repeat for you, just to make them a little bit more comfortable? So we're going to go and do another poll here. We love these polling questions because they get you involved, and then it's not just me jabbering on. Although my voice is lovely and wonderful. So we are going to launch this poll. What is nutrition literacy? So I just want you to take a look at the answers and answer the best that you can. And if you were at the summer workshop, you have a jump start on this. Let it go for a little bit longer. All right, thank you for answering. So I'm actually going to share the results so that you can see them. So nutrition literacy, it encompasses a lot. It encompasses, we're just going to go through here. It encompasses the whole gambit. How they get their nutrition information, where they're getting it from. If they're not getting it from a nutrition educator or registered dietitian, where are they getting it from? And is it good information? How they sort out the information that they're getting. Sometimes we throw out a lot of information, but all of it may not be appropriate for everybody. So especially like if you're teaching a class and you've got a group of people, the information that you're giving to them, some people may just need a little bit or parts of it. And so how they're sorting that out and understanding that, what information is appropriate for them, their level of understanding about the information that you've just given them, how they understand it, how well they understand it. And then this is so, so important because a lot of times I think we think of nutrition literacy as, are they able to read the brochure that we're giving them? Are they able to understand what we're saying to them? But we also want to make sure that they understand how and when to use the information that we've given them. And for me, when I first started doing things with nutrition literacy and becoming more aware of the disparities in nutrition literacy, that was mind-blowing to me. Actually applying it, actually taking the information or the recommendations that I was giving and using it in everyday life, and being able to use that information to make themselves healthier, to make their families better. That is an important piece of the nutrition literacy puzzle. And I think that's one of the things that we miss a lot of times. So I want to bring up two concepts about nutrition literacy. And the first one is the comprehension. Are they understanding the information? When I give them a brochure, are they able to read it? Are they able to read it and then understand it as I'm talking to them? Are they understanding, those recommendations? Then it's applying it. Are they applying the information that they've gotten from me appropriately? Is it feasible for them? I can tell people, eating salmon a couple times a week is beneficial to your heart health, and they can understand that. They can say, okay, I know that eating salmon is good for my heart. Are they able to go out and purchase salmon to eat? Is it feasible for them? Because if it's not feasible for them, then guess what, guys? We've given them information that they cannot use. And so I want you to make sure as we go through this this webinar, and as you're thinking about what you do on in your everyday life, thinking about what information are we giving our clients or our patients, and is it feasible for them to do? Because that's important, and we need to make it feasible for them as well. And so, okay, maybe salmon a couple times a week is not feasible, but maybe canned salmon is. Can they get that at their food bank or their food pantry? Tuna's full of omega-3s. Can they get that at their food bank or food pantry? And so thinking of ways to make that nutrition information that we know and we think is so important, but making it feasible for our clients. So this is mind-blowing. 43% of adults with the lower literacy levels live in poverty. 70% of adults on assistance have low literacy levels. And then look at that last one. $230 billion a year is linked to low adult literacy. That is astounding. Nearly half of American adults have difficulty understanding and using health information. And so this lack of understanding, it makes it hard for them to make appropriate decisions based on their health and wellness. And that includes nutrition. That includes, when they make decisions at the grocery store or at the food bank. It's a really serious problem that needs addressed, and I'm so glad that PANEN has given us the opportunity in order to address it, in order to discuss it, because this helps to create change. And so as we go through, think about different ways that you yourself in your everyday life can impact this. So let's talk a little bit about the disparities in nutrition literacy and nutrition literacy assessment. So if you were in my summer workshops, we got to actually pick apart different assessments for nutrition literacy. And so we're gonna discuss those briefly here today, just because I want to point out that health literacy is a big deal. Okay, a lot of people are talking about health literacy. It's kind of one of those catchphrases right now. But not a lot of people are talking about nutrition literacy. And when you look at health literacy, a lot of the discussion around health literacy is about health in relation to nutrition, and we're not talking about that as a huge problem. We focus on more of the health literacy. I want to challenge us to focus on the nutrition literacy, because it has a lot to do with health literacy. So the issues are that most nutrition educators aren't assessing for nutrition literacy. I didn't. When I worked outside of the house, I didn't assess for nutrition literacy. And I would bet that 75% of the time I was talking over people's heads. because I wasn't assessing. I wasn't asking the appropriate questions, or I didn't have a formal assessment in order to really appreciate where they were at in their nutrition walk. Many health literacy tests do not focus on food and nutrition. So we're gonna look at one, I think, really great health literacy test, but it has nothing to do with nutrition. There is a nutrition literacy assessment called the Nutrition Literacy Scale. We're going to talk, let's just go through that. It's 4 pages long. Can you imagine sitting with your clients and giving them this assessment and asking them to take it? And every group this summer, when we looked through this, A, they said it was too long, and B, there were issues inside of the nutrition literacy assessment. There were nutrition literacy issues. Some of the questions were difficult to understand. And so if we're doing this assessment, if we're giving this assessment out, I would bet that a lot of people wouldn't be able to read it. So we're doing an assessment for nutrition literacy that they're not literate enough to understand and read and complete. So this one was a tough one for me. It does assess demographics, which I think is really cool. So that, if there were, research on nutrition literacy, this would be, a great starting point, is to understand the demographics. But overall, this was, I think the thought was there, and in theory it was awesome, but I really think it needed a dietitian's point of view. So that was one. Another one was called the Food and Nutrition Literacy Questionnaire. This was kind of cool because this was for kids, 10 to 12 years old. This was actually done in Iran. And it was based on Nutbeam's hierarchical model for health literacy. So they kind of picked apart health literacy as a risk factor and health literacy as an asset. So health literacy as a risk factor is more of a clinical diagnostic piece, and then health literacy as an asset more for like a public health piece. So they found this to be a valid method of assessing nutrition for these kids in Iran. In our summer workshops, we took a look at this one too. And we all said, we don't know any 10 to 12-year-olds that A, would be patient enough to sit through this, and then B, to understand it, to understand the different questions. And it wasn't in the native language. It was actually in English as well. So, but it was a little involved as well. And so, we decided that this wasn't really a valid questionnaire that we would be able to use on our clients quickly and adequately. This is an assessment for health literacy. It's called the Rapid Estimate of Adult Literacy in Medicine. In theory, this one is awesome. And I think for health literacy, it works really well. I'm going to show you what the words are. So basically, you would have a client come into you, and you would give them a list of these words. And what you would do is you would ask them to either read it silently or read it out loud to you. And if they were able to read the word, they got a point for it. So for health literacy, they would go fat, flu, pill, osteoporosis, allergic. And if they couldn't pronounce it, or they didn't know what the word was, then that would be the healthcare professional's kind of indication of where their health literacy lies. Again, this is not specifically for nutrition. And so it's not something that we would use with our clients for, again, nutrition literacy purposes. Could we use something like this with words related to nutrition? Absolutely. I think that might be something in the summer workshops, I brought it up, that we could have a list like this. And my problem with the realm is that it was if they could pronounce it or they knew what the word was, but it never it never in the directions stated, does the client or the participant, do they understand what the word means? And so they could read fat, right? They could read fat and think that it means someone large. But in the nutrition world, that could mean oils, nuts, butter, things like that. And so I think it's important that for nutrition literacy, that we understand the context of what our clients, where they're coming from. Because again, when we say fat, I think a lot of people tend to gear it towards weight, where we as nutrition educators are gearing it towards the food group. And so that's an important piece too. And when we talk about, especially like written nutrition information, written brochures, things like that, it is really important to know where the people that you are trying to reach are coming from. Okay. So I'm going to bring up another poll here. I'm going to move. Sometimes I feel like the headless horseman. I move my face around all the time. Yes, I can see my own face. I move it around all the time, and I feel like the headless horseman. So appropriate for Halloween, am I right? So I want you to take another poll. How do you assess nutrition literacy for your own clients? How do you know where they're at? How do you know? Can they read? Can they write? Can they understand me? How do you know? So go ahead and take the test. You can select as many as you want. This is a select all kind of thing. Have you even thought about it? You know, maybe this is something that you've never really thought about. Like for me, this was not something that I thought about often. And so how do I assess the nutrition literacy of somebody that I'm talking to, or even a group? I think groups are difficult when you're talking to a group of individuals who may have nutrition literacy levels all over the place. All right, thank you. I'm going to actually show you guys the results so that you can appreciate them as well. So most of you build or understand where your clients are by just basically talking to them, right? To kind of get their maybe their language or their speech, or maybe asking them different questions. Some of you are looking at nonverbal cues. Awesome. Like, I don't have a clue what you're saying. Building rapport over time. I think that is so important, because once you build rapport, your clients are then more comfortable to come to you with concerns or questions. And they might come to you with something that you said weeks ago, and they're like, you know what? You said something weeks ago that I wrote down. I don't understand what it means. So that's awesome. Asking them their level of understanding. There is nothing wrong with that. There's really just nothing wrong with asking them, you know, okay, we talked about weight loss, or we talked about healthy recipes. Did you understand everything I said? Is there something that you want me to go back and touch base with? Did something not make sense? Sometimes, you know, when I talk to a lot of groups, and when I'm in a class setting, and if I can see people's facial expressions looking at their nonverbal cues, I can identify that they might not quite get what I'm saying. And so I will go back and say, I see a lot of confused looks. Can we talk about, and whatever the topic was. So that's awesome. That is awesome. All right. I'm just looking at the comments really, really quickly here. We're taking a timeout till the Headless Horseman can move her head around here. No, I was not at UPMC Shadyside, but I did work for UPMC, the John Murtha Cancer Center in Johnstown. Amy, the realm seems like a quick way to make your client feel badly. Yeah, absolutely. We brought that up in the summer workshops. Amy said that the realm seems like a quick way to make your clients feel badly and not very smart. It's almost like you're quizzing them. If you give them, a piece of paper and say, okay, what does this word mean? Absolutely. Absolutely, Amy. So that's why I think, talking to them, asking questions, asking if they understand, looking at nonverbal cues. So that's a really important piece of this. All right. Again, headless horsemen are moving around here. All right. So let's talk about that client interaction. I'm going to actually read you some things that I found it's Halloween, that horrified me when I found them. So I took this from actually a Witt County website. I will not tell you what county. It wasn't in Pennsylvania. It was a written sign, okay? In this class, you will identify what foods are right for your infant to eat now and in the future. You will choose a way to prevent early childhood tooth decay in your infant. We'll talk about the challenges of breastfeeding the older infant and when it's okay for mom to limit calories to promote weight loss without affecting breast milk. And then it goes into getting a sippy cup. But think about that. That was on a written sign. So all of those things were on a written sign about the class. There was a lot of words in there and a lot of words that may not be familiar to a lot of people. So I suggest, instead of that, this. In this class, we will talk about what foods your baby can eat now and then later. You will also be able to choose what foods and drinks will help or hurt your baby's teeth. We will talk about breastfeeding older babies and when it's okay to lose weight without taking away your milk supply. Simple. Simplify it. Sometimes nutrition literacy, and we're going to get into this a little bit later, but sometimes nutrition literacy doesn't mean less words. It means better words. Sometimes people think, okay, well, I need to, shorten this by, a paragraph or two. It's not necessarily being shorter. It's choosing better words, choosing words that are easily identifiable. So in this original one, it used infants. That's a very clinical word that not most people use, that most people don't use. They use baby. And so instead of using infant, we're using baby. Now I know in the clinical world, we use infant for, a different age of baby. But when we're talking to the general population, we want to use words that they are familiar with, okay? Here's a diabetes counseling one, okay? Your doctor recommended you to see me today for diabetes. So we're going to talk about your glucose levels, carbohydrates in your diet, and balancing meals with protein. Controlling your diabetes with fiber-rich foods, lean proteins, and heart-healthy fats will be important to help avoid diseases like atherosclerosis, cardiovascular disease, neuropathy, nephropathy, and vision loss. Seriously, are you looking at my face? Seriously. I don't joke around about these things. And so when I see something like this or when I hear something like this, my blood starts to boil. You lost them at your doctor recommended. You did. If you're talking like that, you have lost them. Here's what I suggest instead. Your doctor let me know you have diabetes. Could we talk about what diabetes is and how we can work together to control it? That's it. It's simple. It's a simple way of communicating to people that will get on their level. That is the main point of this. I need you to get on their level and to start where they're at. Because if we're starting 10 steps ahead, you have lost them already. And they are not going to take the recommendations that you've given them. That may be awesome recommendations, but they're not going to take those with them home. They're going to forget about them. Or it just totally went over their head and they're not even listening anymore. Okay, so let's talk about what we do about that. So overcoming this barrier. The first step to overcoming, we're going to talk about understanding our clients, understanding human beings people, the people that are coming to see you, or your friends that are, when you go out to dinner and they're asking you 500 questions about nutrition. Yeah, it happens, doesn't it? We're going to talk about creating materials that are appropriate to our audience, and then being a nutrition advocate in our career or at our work site. So, understanding our clients. I have consulted with many, many people throughout my career, all right? Inpatient, outpatient, all types of insurance companies or insurance backgrounds, community settings, work site settings. I've been to blue collar work sites. I've been to white collar work sites. I've been to many different settings, and let me tell you something. Building rapport starts with a smile and an introduction that doesn't make you feel stuck. An introduction that makes you a human being. Yes, you're a nutrition educator. Yes, you're a healthcare provider. Yes, you are, you're going to talk to them about nutrition, but I'm telling you, building rapport starts with a smile and a good introduction. Because then you have them hooked. Then you have them in a place where they are now relaxed. I cannot tell you how many times I have seen individuals, one-on-one especially, who leave saying, that wasn't as stressful as I thought it was going to be. I hope it's not as stressful, because it shouldn't be a stressful situation. Even as simple, how's your day? How you doing? Asking them about themselves, something to get their attention and to keep them going. Speaking with them, we're going to talk a little bit about that in a further slide, but I think a lot of times we feel like we need to get a point across, and we are going to tell them the information that we need to tell them. We need to speak with them, not at them. Because when we speak with them, they are now involved in their own nutrition decisions and their own food choice decisions. When we're speaking at them, they are not in control. We are. And the unfortunate part about us being in control and not them being in control is that when they leave, they're still not in control. When they go to the grocery store, they're still not in control. So allowing them to be part of that process, that decision making, is going to make a difference when they leave your office. Looking for nonverbal cues. Again, when you get that glazed look, stopping and saying, is there something that we can talk about? I see that what I'm saying may not make sense. Can I say it in a different way? Can I try that again? And put it on you. Because honestly, you're the nutrition educator. And so if they don't understand, it is on you. You need to make sure that they understand before they leave you. All right. Saying, you give a recommendation and asking them, when I say that, what did it mean to you? When I say whole grains, what does that mean to you? When I say healthy fats, what do you think that means? And asking them those types of questions. I know a lot of times we may get people that we're talking to that seem very disinterested. It happens. Maybe they're having a bad day, or maybe that's just how it is. I have a question that I think might either make them rethink being with you, or it may make your session go a little bit better. And the question is, this doesn't seem to interest you. What would you like to talk about in regards to nutrition that would be more interesting? And it may get uncomfortable for a second, but I have said this before, and what I've come to find out is that the topic that we were talking about, or that I wanted to talk about, wasn't really what they needed. They may not have known that, but they may come up with something like, well, I heard that so-and-so said, so-and-so on TV said that you should take this. Or I heard that this is the best diet for diabetes, or I heard that, you should cut carbs for weight loss. And so you may have been talking about something totally different, recipe modification or grocery shopping, but they really wanted to talk about something else. They may not have known it at the time, but when they start talking to you, then they're involved and they are, again, more interested, and they're actually being able to choose something and kind of run the show. All right. So how do we build rapport? What are some ways that we can do that we can build rapport? And I'm actually going to throw up another polling question so that I can see what you guys are doing, because that's all part of this webinar process, is to kind of learn from each other. So how do you build rapport with your clients or your patients or the people that you're seeing every day? Go ahead and answer. It's a multiple choice, so you can select more than one answer. All right, just a few more seconds here. You guys are rocking it. You're like, I do it all. I'll show you what I mean when I all right. So I'm going to share the results a little bit. So yeah, you guys are doing that. I love that. Make sure they know that they're able to ask questions. That is a huge part of building rapport. So that's awesome. Thank you. Thanks for that. All right. So absolutely, building rapport starts with a smile, right? Smile at them. Invite them in. Be warm and welcoming. Be aware of yourself. If you have facial expressions that tell your mood or interact with people and what they're saying, you may want to just be aware of those facial expressions. Be aware of your surroundings. If your office space or your cubicle looks like chaos, it might feel to the person a little chaotic. Use appropriate self-disclosure. I love this, especially with kids. If kids come in to see me, or I've seen kids and they've got a football shirt on or a jersey on, or especially like a hockey shirt, something like that, and maybe it's not the team that I like, but I'm able to joke around with them about it. That helps kids relax a little bit when you can identify with them on their level. And then continuing that open discussion through it. So, after we build that rapport, we start talking to them. And so I want you to think about the questions that you're asking your clients, because these can be the secret to nutrition literacy success. So asking the clients how comfortable they are. How comfortable are you with your diet? If I say choose whole grains, what does that mean for you? What are some of your favorite veggies? Just to get them talking, okay? We want to make sure that we kind of balance on that fine line of not speaking over them, yet not insulting their intelligence, right? So it's finding that fine line. So this is what I said when we talk about talking with or to or at, okay? You need more vegetables. Let's talk about that. Instead, I suggest, I'm seeing that your veggie intake is low. Do you mind if we talk about what veggies are your favorites? So that kind of welcomes them in and talks about that. They might say, yes, I mind. On to the next question. That might not be something that they're interested in talking about, and that is okay, because when you find what they're interested in talking about and you discuss it and you talk about it, you are going to get further than you ever thought possible. All right? So you can read those other things, on your leisure, but really it's about inviting them in. Could we talk about this? Would you mind if we talked about this? Those are kind of the leading questions that I want you to think about. So tips on speaking with clients, I want you to speak on their level, right? I want you to speak on their level. And this goes both ways. I've been at, let's say, blue collar companies. Going in with super professional talk and mannerisms and things like that, that can turn people off. All right. As a real person, as a real girl, that kind of turns me off. I like when people are more laid back and more relaxed and more jovial, right? So the reverse happens when you are at a white collar. Maybe you are in an office setting, or you're at a setting where there are people that are more professional. Maybe they're wearing business suits and things like that, speaking more professionally to them. Okay, so it really depends on where you're at and who you're talking to. Be a real person. You don't have to be so serious, okay? Lighten the mood, smile a little bit, throw in a joke here and there. I'm a super huge pun person. I love puns. I think they're really punny. So you want to make sure that you're being yourself and making sure that you're making them feel welcome. Watch your nonverbal cues. Allow for silence. If you're asking a question, pause. Take a deep breath. The silence, that silence can be golden sometimes. Be flexible. Like I said, if they don't want to talk about what you were planning on talking about that day, be flexible, okay? And then know your stuff. Make sure you're well read on different fads and different things that are going on in the nutrition world. All right, so I'm going to just take a look. Okay, Suzanne, what are ways we can work with uninterested participants when we are required to teach specific lessons from curriculum? That's a tough one, right? That's really hard, especially when you're required to teach a specific thing. It might be advantageous for you to say, this is what we have planned to talk about today. Go over a nice summary. Is there anything about that interests you? Is there any topic that we can pull out of that we might be able to ask? Make it fun, perhaps. Make it a game. Those are the types of things when you are required to do a subject that can be a challenge. But asking them maybe what they're interested in about that topic can be helpful. We all know about nonverbal cues, but this can open the door to honest and open communication with your clients. So making sure that you're well read on your nonverbal cues. I think a lot of nutrition educators were very sensitive to that. So that's to our benefit. All right. This is a big one. The general appearance and dress of somebody can be a big nonverbal cue. Body movement, posture, gestures, facial expressions, eye contact. This is one I wanted to bring up really quick. Eye contact can be very cultural. So make sure you understand the culture that you're talking to before you think that they're disinterested or that they don't want to look at you, because in many cultures, eye contact is disrespectful. So putting a plug in for that. All right. Creating materials. And this is about written materials. If you've done readability scores, or if you've studied readability scores, they are important. They have a purpose and a place. However, they are to be used with caution because, again, fat. If we say fat, a lot of people are going to think overweight when we really mean dietary fat. And so although fat is very readable, it might not be the best word, or we might have to explain ourselves a little bit more because of the different understandings or the different definitions. When you're writing something or when you're making a brochure, you want to state your purpose immediately. Don't waste time. Make your sentences clear cut. Limit information. A lot of pictures go a long way. So if you've got a picture with a small description, pictures are worth 1,000 words, right? And you want to have something where you can repeat and summarize. So all the best handouts and all the best informational things are very short, sweet, to the point, look pretty, are colorful, and have a lot of pictures. When you look at pictures, they tell you different things, right? So this picture on the left, when I brought it up in the summer workshop, looked like a Food Network photo shoot. Fresh, lemons, fancy was a word. high end, expensive. Picture on the right, down to earth, children, fall, apples, general, And so when you use pictures, make sure you're using them appropriately. Make sure you're using them based on the clients or based on the population that you are providing written materials to. All right. So what about kids and teens? All right. We are going to do another quick poll here. Did I never end the poll? Note to self, stop sharing the poll. All right, so we're gonna launch this poll here. How do you break the education or the nutrition literacy barrier with kids? Throw up, go ahead and select your answer. If you have another answer, go ahead and type it in the comments. If you work with kids, what are some ways that you kind of break down that nutrition literacy barrier? Nice. All right, a couple more seconds. You guys are awesome. All right, I'm just going to share the results with you so that you can see them. So yeah, 93% of you are making food about fun and nourishment. It's supposed to be not about calories. I don't know if I missed the calorie word in there. So that's awesome. Young kids, they like to play with food. They like to smell, they like to touch. Older kids, science, cooking skills. Kids are getting into cooking at an earlier age now, and I think that's wonderful, and I think that's awesome. All right. So again, yeah, making school fun. For preschoolers, it's sensory, it's gross motor, messy, songs, being silly. For elementary, it's cooking. They start cooking again at a younger age, identifying food with health. All right, identifying those foods that can benefit your body, using it in a math and science lesson. High schoolers, advanced cooking skills, making sure that they know, the science behind food, which is super awesome. But also even food safety and things like that for high schoolers. That's really important. Do not focus on calories. Focus on well-being. Focus on health. So how can you be that nutrition literacy advocate? How can you make an impact where you're at and where you work? Start where you are. This is my big theme running through. Start where you are. Whether it's in your office setting, whether it's with the clients that you have now, be aware of their literacy levels. Be aware of how you can identify literacy levels. Be aware of how you talk to them. Be aware of your body language, different things like that. Start where you are. Start with what you can impact. All right. We're going to network and build partnerships. And, that's networking in the community, with different doctors' offices, with, community sites, with food banks, with food pantries, with, churches that have food banks and pantries, with schools, just making sure that we are networking and we're partnering with people that impact the health and wellness of our community. Getting involved in the community. If you know you have a community garden and they might be in need of nutrition information or recipes or things like that, PANEN has it. Check out our website, check out our recipes that we have, check out the different information that's available, print it out, it's free, and give it. Okay, that's why we're here. The last part is be part of organizations like PANEN. Be part of the change that's going to impact overall health and well-being of our community. So, in summary, nutrition literacy is super important. We need it for talking with our clients, but we also need it when talking with other healthcare providers or other individuals that we work with every day, day in, day out. figure out how you can personally assess the nutrition literacy of your audience, and then make sure you're speaking appropriately, starting with you. All right. I'm going to actually turn it over to Rose now. But I thank you all so much for joining in. I know Halloween can sometimes be crazy with, if you've got kids in different things, and if you've got work, dress up parties and things like that. But I really appreciate you logging in and just joining us today and your feedback. So thank you.
Thank you, Amanda. There were 2 comments that were made in the chat that I just wanted to kind of share. I believe her first name is Lori. She commented, I need to be more aware and recognize that just because a client is quiet or has no questions does not mean they understand all of the information.
Absolutely, Lori. Absolutely. Sometimes quiet means I have not got a clue. And so just bringing it up, that does anybody have any questions? Does anybody have any concerns? If it's a one-on-one type situation, I'm noticing that you're really quiet. Is there anything that we can talk about that might make more sense? Or can I say this a different way? I know, I don't think I'm making sense. Put it on you. I'm not making much sense today. Can I make more sense to you? So that's awesome. Thank you.
Marlene commented, I do not work with teens or older children. Marlene, if you can type in what age group or what demographic you do work with, and maybe Amanda can kind of expand on a topic with that. And Julie, thank you for your comment. This was so interesting. Glad I logged in during my day off. Well, thank you for logging on.
You're rocking it, girl.
I have 2 quick polls to do. The first poll we're going to ask is, what other topics would you like to see? We kind of had created a poll. I'm going to launch it. You can go ahead and select as many as you want. And if the topic that you would like to see is not in or listed on this poll, please feel free to put it in the chat area, and we'll go ahead and make a note of that. Our goal here over the next couple months is to actually have a webinar every month to better serve our members and get them the topics that they would like. So it looks like food insecurity and food justice is the top one right now. Behavior change. All right, give it about 10 more seconds. Looks like people are still clicking in. Alrighty. All right. So it looks like food insecurity and food justice, which is great. We actually, for our conference, we actually have Clancy Cash Harrison is actually going to be doing a session on food insecurity. All right. So thank you so much. We appreciate that. I'm just going to go back to the comments real quick. Marlene, thank you for, Marlene talks mostly with parents of preschoolers, children up to the age of 5. All right, so I think I'll have Amanda follow up with you after the call, Marlene. And then my final poll is just if you can give me some feedback regarding how you enjoyed the webinar. Did you think it was excellent, good, fair, or poor? This way we can kind of improve on as we move forward with our webinars. I'm going to go ahead and launch that. And as everyone fills in the rate there, feel free to, I'm going to leave the PSE, yes. Thank you, Tiffany, yes, PSE. That is definitely on our list of topics. And feel free, I'm going to send an email out after this. It'll include information regarding credits for this, as well as my contact information, so you can go ahead and send me any questions you may have, as well as the recording of today's. So, all right. Thank you so much again for sharing and sharing your day with us and being a part of this as our first webinar. And again, I will follow up with an email. And thank you, Amanda, for taking your time and being our presenter. Have a great day, everyone.
See you guys.